どうもありがとうございました。もう時間だというサインが先ほどスタッフの方からありましたので、ちょっとまとめさせていただきますけれども、やはり NCD というのは非常に深淵なる世界、その病気もたくさんありますし、それに対しての治療、それから予防という、それから生活習慣の変更ということで、科学やビジネスだけでなく政策、それから教育、そういったものも一緒になって取り組んでいく必要があると。それから根本には個人の価値観であり生き方というものも関わってきますので、ただ一概に全体的に政策を提示してそれについてやればいいという問題でもないということも分かりました。この問題に対してここにいらっしゃる皆様のような、各界の課題事務者の方が力を合わせて、これから対策を進められていければいいなと思った次第でございます。最後にパネリストの皆様に、盛大な拍手をよろしくお願いいたします。どうもありがとうございました。それでは、最後に、このブロック教授より閉会のご挨拶を申し上げたいと思います。
Thank you everybody coming to UK Embassy. We have collaborated with UK Embassy over the last 2-3 years. First one was the global health issue, which is the launch of BBC, global health, 40-minute special events, special video. And second one was Ambassador mentioned about oncology clinical trials with NCI and also UK and also Korea and Japan. We have just submitted a paper, two recommendations to Japanese authorities. That's under review, and I think we can share this. And this is the first time we are addressing after this UN in this September, and how important it is to address chronic non-communicable diseases. And majority, let's say cancer prevention and also annual exam, I think very prevalent and spread out in Japan. But whether that happens in Vietnam or India, that's a major challenge because we live in one world, interconnected world, and whether we could be very proud of this achievement in the past, but that's commensurated with economic growth. So that's what's possible. But from this now, I think many African countries, it not become possible. Because as I said, aging society, income disparity, and chronic disease burden, and no more public money spendable. So that is the same challenge in the US and UK everywhere. So how to deal with it? Do you really want to, maybe you have to pick up a few low-hanging fruits, which has to be consistent with your legacy. You know, for example, let's say, how to promote exercise in Japan. That cannot be top-down approach from Minister of Health. That's stupid, in a way. That has to be more community-based. And why not community-based, cohesive community? And if somebody do exercise, maybe radio taiso or whatever, and that may help. And that kind of example may be consistent with maybe Aomori, maybe different from Kumamoto. So I think that has to be legacy consistent and which motivate inherent legacy of each country. Now I think we have worked out since 3 levels, Tohoku, tsunami, and Fukushima nuclear. That was a major disaster. That clearly demonstrates to the world the strength of common people of Japan. They worked very hard in a very cohesive way and helping each other. And many private sector responded very fast, like supply chain, not only a big one, not necessarily a big industry. But the lack of leadership in be it the government, and big corporate, mass media, and that become quite apparent, including journalism. Why is it? We have to think about it. That's our weakness. So let's focus on strength, but also we have to recognize our weakness and why such a weakness has been built in Japan. But all of a sudden it's been exposed, which as an institution could not adapt over the last 2 decades after globalization, the end of Cold War, and the introduction of WWW. Right? So that is the weakness. They resist. So that in this chronic disease, non-communicable disease, long-hanging fruits, what would be? That really we have to think about it. And everybody talk about the right thing. But whether this is implementable is a different issue. Because if you argue everything to the political leadership, you will eventually lose. So that each one of you have to discuss your argument, that's fine. But you have to think big. 10 years from now, 20 years from now, from global world, what kind of society you would like to live, then that will become a priority in the political process. For example, recently, this is the same issue, so that I think this is Denmark, in the supermarket. If you want to buy potato chips, which has a high salt, you have to pay extra sales tax. That is a low-hanging fruit. That's educational. And another country, in fact, label all the product with high saturated fat content, so you have to pay extra sales tax. Do you want to do it? And that's then smoking. And this easier, low-hanging fruit, but how to preach such a policy to Japanese audience, particularly male, and also rising smokers like young females. How to approach that? How to incentivize and change their behavior? That must be different from Kenya and Japan and India. Right? So that we have to deal with that. And always you have your own cause, that's fine. But then step back and think big, and then what would be the priority, which become a politically relevant issue and argument. So that helps politicians to develop certain policies. And so that will be my message. And in fact, in conjunction with CSIS, after 3/11, CSIS are now just delivered 2 weeks ago, rebuilding Japan and reshaping together. And that's divided in this security, economy, and other things. And one chapter was dedicated to health. And this health, we have worked together as a partner. And there are three major messages. One is radiation and the long-term health impact. And because we didn't have much of the primary data in Chernobyl, so that this is a great opportunity for Japan to become more open and share this data, so that we could really accumulate and share certain data for the future world. Second one was mental health and psychiatric response to those who have suffered from the disaster and radiation exposure, dissertation, and also abandonment healing. That maybe requires some long-term sort of study. And that's number two. Number three was why not utilize, but see the opportunity for Iwate, Miyagi, and Fukushima, which have been affected to a major extent, to rebuild health delivery system, addressing aging community, income disparity, chronic diseases, non-communicable disease, and no more, let's say, public money. We could rebuild as an example, perhaps in part inviting more direct foreign investment, deregulation. I'm sure when you address that, there's a resistant party all over. But that is a major issue. I think whether we can do it or not. So all the recommendations on these three issues, US are willing to help. Therefore, to create some Japan-US platform which makes Japanese mindset more open to the world, so accepting more, let's say, donation if they will, and that are the core value of this recommendation with Health and Global Policy Institute and CSIS on the health issue, because this is an opportunity for really Japan to try to become different, because we are talking about it last 2 decades, but not much substantive change. Why is it? Everybody talks about leadership, and in fact that may be true part of it. 6 prime ministers in 5 years, that is a disaster. But this is not limited to the political issue. The entire institution of Japan has to change. And this disaster has to be a rare opportunity for this visionary leader to really act, not talk. We have enough talk already, so we have to do different things. So I think this is a great opportunity to share with you the common agenda. One is this issue, which is now become one of the major global health issues. And I think we share the same issue, UK, France, US, that means aging society, income disparity, chronic non-communicable diseases, no more public money we cannot afford. So how are we going to deal with it? That's the question. Thank you very much for gathering and sharing your views.
それではこれにて NCD ジャパンフォーラム全プログラム終了となります。